Hey guys, I am the nurse Dr. Asia, and today we will be inserting a Foley catheter on a female patient. So let's get started. So what are you going to need? You are going to need a Foley cath kit. So it is important that you always look on your package to see what all comes in it. So this package doesn't come with the stat lock, so I am going to bring one. You also want to bring an extra pair of sterile gloves because this is a sterile procedure, and just in case you break sterile, you want to have, a backup. The first things that we want to do is we want to confirm the order. So we want to make sure that the patient actually has an order for a Foley catheter. And then after that, we want to assess if our patient has any latex allergies or any iodine allergies. So we're just going to clean the patient with some warm soap and water, or if you have some type of wipes on your unit, you can use that. So we are going to confirm the identity of the patient because we want to make sure that we are performing this on the correct patient. So we're just going to put on some clean gloves. We've already wet this with soap and water, and we're just going to clean the private area. I'm just going to clean the patient on the first side. Farthest, we're going to go down the further side. And then we're going to come to the side closest to us, and then we're going to go down the middle. So if you are using a no rinse type soap, then you don't have to rinse the patient. But if you are using regular soap, it tends to be you have to rinse it. So you then will go back over with a clean rag with just water, and we would just wipe the soap off. And then we would allow it to dry. So you want to let your patient know the reason why they are getting a Foley catheter and explain to them what is going to happen. So you just don't want to get down here and start doing all this stuff and don't let your patient know what's going on. So you want to explain to the patient that, hey, I'm going to put a little catheter in you. It's going to go through your urethra up to your bladder, and it's going to collect urine. So you should feel some relief immediately once the catheter gets in place. So you will feel a little discomfort, but we'll get it done quick as possible. All right, so this is a sterile procedure. So we're going to take off these gloves. We're going to perform hand hygiene, and then we're going to begin. All right, so I have performed hand hygiene. So I am now ready to open up my kit. So we're going to pull this little flap here. And then I'm going to pull out my kit. Now, some people like to set up their sterile field on a bedside table or something, but me personally, I like to set it up on the patient's bed. So I just have the patient move their legs, out the way, and I have all this open area that I can set up my sterile field. All right, get all the wrinkles out the bed. So we're going to pull this tab. Alright, so now that we have our sterile field open, I now need to add my stat lock to my sterile field. So how do you add something to your sterile field? So this is not considered sterile, because it's the outside, but inside is considered sterile. So I'm going to pull back here, and then I'm just nicely going to not touch anything, but I'm just going to come overhead and drop it on my sterile field. Alright, so now that I have my sterile gloves on, I can only touch sterile things. So I will be able to touch everything that is in the box. But if I touch the patient, if I touch the bed with my hands, I'm not going to be sterile anymore. First, you want to just go through your kit to see what all do you have. So I got my stat lock, I got my swabs, I got 2 swabs, and I have my jelly, and then I have my flush. So what I love about this is that this is my sterile field. So that means everything that if it fell right here is still considered sterile. So what I'm going to do is I'm going to just set some stuff to the side. All right, so this is what I like to do first. I like to go ahead and set up. So you got this if you were going to do a sample, but we're not going to do that. So we're just going to take that off our field. So I'm going to go ahead and attach my syringe. I'm going to go ahead and attach my syringe here. So this is sterile water, so I'm just going to attach it here. All right. Okay, so I zoomed out so you can be able to see everything. So I have my my flush hooked up to the little port right here. So this is going to help us blow up the balloon, okay? So next, I'm just going to look and see what's all in here. My stat lock, I don't need that right now. And I have a fenestrated drape, so I'm going to use that. And then you also have another drape. I'm not going to use this one, but it's up to you. So the next, I have my petroleum jelly. So I'm going to go ahead and open that. And I'm just going to go ahead and put the jelly in the tray. take the cap. I'm going to take this little covering off it. I'm just going to drop that on the floor, and then I'm just going to rub this in the jelly to get it nice and lubricated. So this is going to sit here until I am ready. All right, so the next step that I'm going to do, I'm going to take my fenestrated drape. So remember, shiny side is going to go down, and I'm going to place that on the patient. So now we have the patient nicely draped up. We're able to see the labia through the little peephole right here. So next, what I want to do is I'm going to go ahead and open up my swabs. I'm going to place them on my sterile field, and I'm just going to drop this in the trash can. All right, so what you're going to do next is you're going to prep the patient. So those are our iodine swabs. So I'm going to take my non-dominant hand, which is my left hand, and I'm going to place it on the patient, and I'm going to open up the patient's labia. So you guys, once I touch that patient, I'm no longer sterile, so that is my dirty hand. So I have to do everything with my right hand. That's why you want to choose your dominant hand to work with. So I'm going to take the swab, take one swab, and I'm going to go to the sides furthest away from me, and I'm just going to wipe it down. All right, then I'm going to toss it in the trash. I'm going to come and get another swab, and then I'm going to go to the side that is closest to me, and then I'm going to wipe down there. Toss it in the trash, and then I'm going to come back for my last swab, and then I'm going to go down the middle, and then I'm going to toss that in the trash. So I'm still considered sterile. Now you guys, on this mannequin, it's going to be super easy for us to see the urethra, but in real life it's not that simple. So you want to make sure during this time right here that you actually pull the labia apart so that you're able to see their urethra. So where is the urethra? It's like a tiny little hole right above the vagina, okay? So we want to let our patient know, feel some discomfort from the calf. So we already have our calf lubed up. We already have our syringe hooked up to blow up our balloon. So now we're ready to go. So we're going to take our calf. So you want to tell your patient if they want to take a deep breath in when you're going in. So we're going to visualize where we're going, and then we're going to tell the patient, let's go. So you're going to keep going, 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 and going. So you should see a flash of urine. Once you see a flash of urine, you're going to advance just a little more, and then we're going to blow up our balloon. So you want to blow up, you want to use how much ever they tell you to use. So if this is a 10 cc syringe, so we're going to use the entire 10 cc syringe. All right, so now the cap is blowing up in the patient, and we have to disconnect it from here. So we're done inserting in the patient, so we now can come here and just disconnect. So what do we want to do now is we want to give our tube a little tug to make sure that it is in place. So we're going to apply this skin protectant to the patient's thigh. So we're just going to rub it on the patient's thigh where we're going to place the stat lock, and we're going to allow it to dry, okay? So then you're just going to pull back aside. All right, so then we're going to place that on the patient's thigh, and then we're going to pull back the other one. And it should look on the patient's thigh like this. So we can actually remove this right now because we're done. So once the Foley is inserted into the patient, the sterile part is over. So we're going to take our stat lock, and we're going to come on this side, and I would just hang this on the bed. So now we have the patient securely in the stat lock, and now you're good to go. You guys, I hope you learned a lot about putting in a Foley cap.